Hey, good morning, everybody. It's Diana Zenny with Think Crunchy, and I am so excited to have my dear friend Jenn here, Dr. Jenn, with us. And she is going to talk to us about pain today. And I just want to kick in that I went and saw Dr. Jenn this week, and she is incredible, has a wonderful bedside manner, is incredibly knowledgeable, super thorough. I was kind of blown away by the experience, to be honest with you. And I have seen a couple of PTs in my life personally with my children. So it was just such a positive experience. So I'm excited to hear what you have to say about pain because we had some conversation about this week.
Mhm.
But I know there's always more to learn. So welcome. Thank you for being here.
Thank you so much for having me on, Diana. And hello to the Think Crunchy community. I'm Dr. Jenn from Physical Therapy by Jenn, as Diana had said. I have been a manual physical therapist for 26 years, which means like a hands-on therapist. And part of my technique, besides the hands-on and giving exercises and looking at your posture, is teaching you about pain neuroscience. So it sounds kind of fancy, but it basically means how does your body deal with pain, or how does it process pain? Because if you think about it, what really is pain? Well, pain is actually supposed to be a good thing. Like if we didn't know that if we touched the fire that we would get burnt and hurt, we wouldn't have survived very long as a caveman, right? Like we tell our kids, don't touch the burner, it's hot. Don't touch the pot, it's hot. But what happens? Eventually they do it, they go out, and they really stay away from that. So it's actually supposed to say, hey, danger, don't do that. So it's supposed to be a good thing. If we hurt ourselves, pain is telling us, oh, I probably shouldn't walk on my ankle if it's hurting that much. I should go see somebody, get an x-ray, ice it, whatever. So it's supposed to be a good thing. However, we are not supposed to live and remain in pain. But I bet of the people listening that some of you are experienced with chronic pain, unfortunately. I bet you know someone who has chronic pain. I have been seeing a lot more kids with chronic pain. And I'm doing this webinar because I want to teach you how to deal with it and what it is all about. Because studies show that the more you know about how and why pain works in the body, get this, the less chance you have from having an acute pain that lasts maybe a couple of days to a couple of weeks, becoming a long-term years of pain. Okay, yay. And if you're having chronic pain, it will help the recovery process. So let's get started with this amazing stuff. So first of all, we're going to talk about how the brain names the pain. All right. So what does that mean? So the way I was taught 26 years ago, and even 5 years ago, people have been taught this in school, and now it's trickling down. What really happens is, let's say you hit your elbow, which, by the way, is not really funny, right? Funny bone. It's the humorous, but it's not really funny. So you hit it. That does not feel good, right? We were told that your funny bone, or your humerus, tells the nerve, which tells the spinal cord, which tells the brain, hey, I have pain here, do something. Like if it's a really bad one, like you fell on it, maybe get an x-ray, or see the doctor, or see your local chiropractor or physical therapist, or put some ice on it. But actually that's not true. Here's the cool part. What actually happens is you hit your funny bone or something else that causes discomfort, and the bone or the soft tissue or the ligament or the nerve, whatever, tells that local nerve, hey, I have a sensation. That message then goes up to the spinal cord and up to the brain, and it says, hey, the elbow has a sensation. The brain then has to decide, is that sensation a threat? And therefore, do I qualify that as pain? So, for example, my poor husband, I love him dearly, but he has a very sensitive toes for whatever reason. And so when he stubs his toe, he's like, oh my gosh, my toe. My kids normally step on him all the time. So he's like an agony in the corner. And then my kids step on my toe, like, oh, mom, I'm so sorry. I'm so sorry. I'm like, it's my toe. I'm fine. I'm not your father. So why can each of us have the same thing, but our response is so different? Because our
Right.
brains are different, right? So my brain's like, you get migraines sometimes. Elbow is nothing. Just shake it out and deal with it, Where
Yeah.
he's like, man, I need to put my foot up and ice it. So God bless him. So so basically the brain names the pain. So let's talk about this, because if you think about it, when you go to your doctor for a painful area, or your chiropractor, or, and chiropractors and PTs were a little bit more into this. The doctors are getting this now. But they don't say, okay, you're hurting here. Hey, have you been under a lot of stress lately? How's your brain feeling? Does this make you feel more anxious or more aggravated? Do you have less tolerance for your kids when your elbow is hurting? They don't ask these questions, right? But that's the whole brain part of it. So here's the deal. This, you probably already knew this, but didn't know you knew this, because let's just say you're crossing the street, there's a giant pothole, and you step in it and you wrench your ankle really bad. Okay. But there is a speeding UPS truck coming straight at you. Is your brain going to tell you that you have pain?
Nope.
Yeah, and Diana is right. It's not, because your brain's going to say that speeding UPS truck is more of a threat than my ankle right now. So you're gonna run or hobble, whatever, across that road. But once you're clear, then your brain's going to say, okay, now I'm going to make you have pain because I want you to go ahead and ice it. Don't walk on it. Get an X-ray. See someone, etc. Right? And we all kind of knew that, but yet we didn't know that. So the brain is the big thing. So here is a really cool story that I like to tell, and it's a true story. Okay, so there was a construction guy, and he had those steel tip like construction boots, like really heavy boots. Okay, and he was at a job site, and he actually was using a nail gun, and I guess he missed or something happened, but he actually shot a nail into his foot. Okay, not happy, right? Actually, he shot it that way, but still, okay.
Oof.
So he starts, immediately collapses, screaming. I mean, he probably was swearing a little bit, and so they call EMS, and EMS comes out, and he is in so much, they're giving him meds, they get him to the ER, they get him on a morphine drip because the guy is in so much pain. He's sweating and he's red, and his blood pressure's going up and his heart rate's going up because he's in pain. And so they're now trying to cut the boot away from the foot to see what's going on. How far did the nail protrude? We have to do surgery, all this stuff. So they take the boot off very carefully and pull it off. And what do they find out? The nail actually went between the toes and never penetrated the foot. But why was he having pain? Because his eyes saw that a nail went into the boot, thought it was the foot, and so his brain said, we have to create pain, we need help. The minute he saw that with his eyes, pain gone. True story. And there's a lot of stories like that. Isn't that amazing?
That's wild.
Yeah.
So the pain was real. He was in actual pain.
Oh, absolutely. Absolutely. Yeah. And unfortunately, people with chronic pain are told a lot by medical professionals. And if this has happened to you, anyone here listening, I am sorry, because it happens a lot. Patients come to me and they have all these stories where doctors or other professionals will say, oh, it's all in your head. No, it is. And anyone's listening here, it is not in your head. It's in your nervous system and in your body. Okay. You are not making this up. They even did some studies and found that emotional stress in the brain can cause physical pain. Okay. And so, I mean, there's a huge link. So, yeah. So another cool story so how did they figure this stuff out? So you guys, some of you probably had an MRI. No one's done someone who does. So with an MRI, you have to stay very still, right? They even tell you to hold your breath at one point, and it's a long process. Now, functional MRIs came out about maybe 10 years or so ago, and that's what led to all these breakthroughs in pain neuroscience. What they did is they basically put a patient in the MRI, okay, and they said to the patient, Okay, I want you to go ahead. So Susie, it hurts when you lift up your arm. Okay, go ahead and lift up your arm. And she did. And they looked to see what areas of the brain lit up. Okay.
Okay.
And then they said, okay, Susie, I want you to stay perfectly still and just think about raising your arm. And guess what? The same exact areas on the MRI lit up. So let's think about
Wow.
that. Yeah, right? So if the pain is caused by the peripheral body part, like the arm or even the spine or the toe, how could her not moving and just thinking about moving that body part cause the same areas to light up? Isn't that amazing? Yeah. So what does this mean for us? So this means that as a whole, medically, whether we're more in the holistic community or more in the traditional medical setting, or a little bit of both, yeah, I kind of straddle both. We need to look at the nervous system and not just the body part. So the brain, the spinal cord, all the nerves, and the affected body part. Okay, very, very important. And again, we're not supposed to be in pain all the time. Okay, so let's talk about our nervous system. All right. So everyone's kind of heard now about fight or flight. That's one nervous system. And the other one, which is the rest and digest. Okay. So, fight or flight is something happens, like let's say we're driving along, someone pulls out in front of us and we react. And then as things are okay, we just calm back down again. We're not meant to live here. Okay. So how many hours a day, Diana, do you think we're supposed to be in the rest and digest nervous system?
Supposed to be, I would
Uh-huh.
say the majority of them, right? So definitely while we're sleeping, we should be doing
Yeah.
all of that. And
Yeah.
then for waking hours, I would say darn near all the time. I don't know.
Correct answer. Correct answer. Yeah, absolutely. Like 23 plus hours.
Yeah.
Okay.
Okay.
But guess what? We have social media. We
Yeah.
have world wars going on. We have electronics all the time. I mean, if you have your kids in a traditional setting, they have Chromebooks at third grade. So we're being bombarded by stuff all the time. What does that do to our nervous system? It brings it up. And so we're not really staying in rest and digest as often as we should be. One of the things you will see, if that's kind of where you are or someone or your kids, is they're not sleeping as well. It's harder to fall asleep. It's hard to stay asleep. You wake multiple times a day. At night, you wake up and you just don't feel well rested. That's one of the first things to affect, because if you're in fight or flight almost all day, you're not going to be able to transition over into that rest and digest, right?
Yeah.
So I want to just show you. So this is our little, let's see. I gotta put it next to me apparently. There, is that okay? Okay.
Yeah.
So here's where we're supposed to be. Okay, that's our
Mhm.
normal level. Okay, where things are kind of calm, we can react to something and then come back down. No big deal. Okay. Now, when our nervous system is staying in a more elevated position, it means we're staying more up here. Okay. And you can see the very top, it says firing level. What does that mean? So that means, sorry, I'm going like backwards here. So that means so basically, this is the level where our nervous system goes off and says, danger, danger, danger. Here's the little alarm over here. See it? Okay.
Yep.
So if we're staying at a higher level here, it means that we're more likely with an activity or something going on in our life to hit this area and be dangerous. So that's like when we say to ourselves, oh my gosh, I'm already fed up to here. I mean, there's days you come home and you're nice and relaxed and you can tolerate your kid having a tantrum, right?
Right.
And it's not great, but or there's days that you come home and your teenager is on your last nerve and he barely said 2 words to you. Okay, because your nervous system is up here, and so you're more closer to your system saying, okay, danger, you're gonna get a headache now, or you have
Mm.
tension in your shoulders, that kind of thing. Okay, so
Yep.
the big thing with pain and chronic pain. So chronic pain is defined as pain for more than 6 weeks. That's not a lot of time, right? And then basically what's supposed to happen is tissue healing. So tissues are our fascia, which is our connective tissue, our bones, our skin, muscles, ligaments, tendons, even our organs, for the most part, are supposed to heal in about 3 to 6 months. I mean, if you have a broken bone, you definitely heal from that. I mean, if you don't, there's an issue, but you definitely heal by then. So what that means is if you're still having pain, definitely past 6 months for sure, that your nervous system is contributing more to the pain than the actual area. Because if you're supposed to be healed by 6 months, then why are we still having pain? Okay. It means the nervous system is adding more to it. Now, this does not mean, once again, I stress this does not mean that the pain is in your head, that you're imagining it, that you're having a psychological breakdown, that you need counseling. Right. Now, I will say that one of the ways that you can help to bring your nervous system down is doing some kind of talk therapy. Okay. So there are patients that I will recommend go to someone. Okay. But you can also work on breathing, meditation. They have even found that humming, like, if you try that, you don't know, we're not going to hear you, but if you just kind of breathe in and then hum out, you can feel that vibration. That vibration actually is a great way to stimulate your vagus nerve, which is the nerve that can switch you from the fight or flight to the rest and digest. It can switch you over. So you basically facilitate that vagus nerve through breathing, through humming. If you have a kind of music that kind of relaxes you. I love ocean waves. You put ocean waves on and I'm almost falling asleep right there, which is why I can't use that in my office. I just bought a Zen garden for my office and had my little patient doing that for a little bit with some music on, just to bring the nervous system down. Okay. One of the other ways you can help yourself, and I think this is great, is laughter. Like they say, laughter is the best medicine. It's actually true. So if you're having a rough day, and again, I'm not dismissing pain, but put on, like, one of my favorite things to watch. I started watching this during COVID, was the Holderness family, HOLDERNESS. They're on Facebook. They're probably on, I think they have a YouTube channel now too. So they just do spoofs of things, and it's family friendly and it's funny. But if you're someone who likes to watch like stupid funny stuff, then the Three Stooges are on YouTube and they're hysterical.
Sure.
So something funny. I had my 7-year-old who was here earlier. We were reading jokes in a joke book, and it was awesome to hear her laughing. Yeah. And as she laughed, guess what? Her pain got better. Yeah. So does that kind of make sense?
Totally. Yep.
Okay. Yeah, it's very different. And unfortunately, with groundbreaking research like this, it can take 17 years to come into mainstream medicine. So a lot of the practitioners in Think Crunchy are already on this, and you've seen this before, but that's why we need to just bring the nervous system down. And what they have found is, again, the more you know about the way pain works, the better you're going to feel, the less likely you're going to have chronic pain, or you're kind of get better. I've taught my son this stuff, and he's 12. He's a little bit more sensitive and a little bit easier to overstimulate. And like, we get in the car and he's like, oh, it was a bad day. And literally we've had conversations where I go, what are 4 ways that you can down train your nervous system to feel better right now? And sometimes he rolls his eyes at me, but most times he'll say, I can do breathing and I can hum and we can put music on or we can tell jokes. And he's right. And they do really help. So I think everyone should know this. Tell your friends, tell your neighbors.
Yeah. May I ask you a question?
Oh, absolutely.
Is there a specific type of music that is more recommended, or is it just more about how you feel listening to it?
Great question. It really depends on the person. I have a patient who has suffered with chronic pain, and she's doing amazing. And she does not do well with piano music. She does better with guitar. So I changed that. I have some patients who are in chronic pain, and one of them especially who's on the spectrum as well, so definitely a little bit neurodivergent, and she prefers no sound at all and more quiet and white noise. So it really depends on how you do. So you can try like classical music. You can try just sometimes they have, I can't remember what it's called. There's like an Indian flute music that's you can find. Go on YouTube and just do that. If you go on YouTube, I actually have the YouTube on my TV right now, and there are different videos. So if you just put in music for healing, let's see, what does mine say? Yeah, music relaxation, music for healing, music for pain. All these things come up and they have beautiful imagery and relaxing music. So you can put that on your TV. Oh, there it comes. You can put that on your TV. And I did that one day. It was like a little experiment. I'm cooking dinner and everyone comes home from work and school and they're all just like, oh, that's really nice, Mom. So I was like inadvertently bringing their nervous system down. You come home from work, you're like, I gotta just, whew.
Oh,
So
yeah.
yeah, it's a nice way to indirectly relax your nervous system. So answer your question, whatever works for that patient, be creative.
Okay.
Yeah.
Perfect.
Yeah, sometimes the sound bath music is kind of nice where you can find that on YouTube. You can get the sound baths on Amazon, but they're super expensive. But yeah, just go on YouTube and just do that one. It's just, yeah, that vibration can be really, really helpful. So,
Wonderful. Awesome.
yeah.
Great tip.
Yeah, of course. So, and let's talk a little bit about diagnostic testing. Okay, this is X-rays, MRIs, CT scans, all the stuff that's out there. Okay, so when should you have one of those done? Now, of course, listen to your provider, of course. However, if you have a trauma, like if you have a fall and you have an injury, or an unfortunate car accident and have an injury, some kind of trauma and pain, it does make sense to get an X-ray, of course. Okay. However, especially if you have like osteoporosis or you're older, so the bones are a little bit more brittle. However, if you just like, oh, I started, oh, my back kind of went out. Oh, I've just been having really bad pain lately. My hip hurts. The first thing you should really not do is diagnostic testing. Okay. Because guess what? Unless you're 20, everybody has arthritis. Everybody's discs are starting to go down as they age. It starts at like age 20, believe it or not. Now, we can still live a full life, okay? But you're going to see stuff. Now, if the doctor sees stuff on the test, guess what? Now, some of them will be like, oh, that's just normal for your age. It's normal wear and tear. We like to call that wrinkles on the inside, okay? We look different when we're 20 versus 40, or like, I think I'm almost 50 at this point, I lose count. Things are a little different. I shouldn't look the same. I mean, I wish I could as I was 20, but things look different. So do your x-rays, okay? So we don't want to be really fixate on that, oh my gosh, you have a disc bulge at L5, that's the issue. Let's now send you to the specialist, and then you're waiting on that. Let's try some medicine, you're waiting on that. And then it's like, what, 6 weeks since the initial issue? Okay, go to a provider like a manual physical therapist like myself, who will take the time to do a full evaluation, your chiropractor, someone who can really look at you and get the hands-on help that you need. All right. I've had many patients come in here and say, oh, well, here's my MRI. I'm like, oh, okay, great. Thank you for the information. I don't like obsess about that, but it's nice to have information. Or here's my x-ray. Because I've been going to see so-and-so, and they're focusing on that L5 the MRI shows, and it's really not getting better. So I do my evaluation. I look at Diana can attest, it's pretty comprehensive.
Very.
Yeah. So let's say it's your low back. I look at your hips, your knees, your feet, your mid back, even your neck. Okay. Range of motion, strength, flexibility. I test the nerves, all that stuff. And I look to see, and even your posture, and I look to see, okay, so your symptoms are here. Like this is your pain. And you also have a weakness here, a lack of flexibility here, etc. All right. And this is what I'm seeing with you're saying this, and I'm seeing this with my hands and my objective evaluation. This lines up more with L1. So I treat L1, and guess what? They get better almost immediately. So you can't focus just on the diagnostic test. It's not the whole picture, number one. And number two, is that just a wrinkle on the inside that they're obsessing
Mhm.
about? You know, I've had patients go in, you probably heard this from a doctor, you know, the doctor's like, oh, look at the x-ray. I don't even know how you're walking in here with this. Look at all this stuff going on. So what happens to your brain? You're going, oh, I have this and this and this. Maybe I should be feeling pain. So
Yeah.
it's really important to look at the whole picture. Unfortunately, as a lot of us have experienced in traditional medicine right now, mostly driven by insurance companies, the visits are getting shorter and shorter. The doctors
Mhm.
don't have time to lay their hands on you the way that honestly it should be done, right? They depend on the x-rays, the
Mhm.
diagnostic tests. And sometimes they don't even fully have time to listen to you. One of my greatest teachers in PT school said, if you just listen to what your patient is telling you, they will tell you how to help themselves. And I do the whole comprehensive evaluation, but usually from just the patient talking to me on the phone or just talking before he's getting started with stuff, I can tell which direction I'm going in. Now, it's not always 100% right, which is why I double check with my
Of course.
testing, but you have to listen to your patient. But traditional
Mhm.
medicine, we have shorter appointments. They tend to cut you off a lot. They're looking at
Yeah.
the x-ray and the MRI. So just know that's not the only picture. And also know if someone's told you, oh my gosh, I have disc bulge from so-and-so and so-and-so and so-and-so, doesn't mean that that's going to be your story. I've had patients come in here who were told that they need surgery to correct their scoliosis. Now, mind you, some scoliosis does need surgery. I'm not trying to downplay that. And she's like, I'm just trying to avoid surgery. And within a couple of sessions, she was mostly pain-free. She comes once a month for a little tune-up, and it's been several years now, and she does not need surgery. But if she went to a certain
Yeah.
doctor, like a surgeon, who that they would probably say that she needs surgery. So just,
Definitely.
you know, yeah, be assertive for your own care. Unfortunately, a lot of us practitioners like myself who give you more time, because of that, we're not able to take insurance. We have to do more of a cash pay approach, or we can take your HFSA card or what have you, give you a receipt to try to reimburse your insurance. But if
Mhm.
your insurance, they basically want you to want, as a PT, I was having to see a patient every half hour and double twice a day, which meant that I usually had 3 patients at the same time. Now I would try to do a good job and say, okay, Mrs. Smith, relax, I'm gonna work on you a little bit. I need you to do that, and you go on the bike, and that's just not quality care. It's what we call
Mhm.
factory care, and that's basically what you see most days now with physical therapy, which is why I'm a little bit more of a specialist. I do a 90-minute evaluation where I talk to the patient, I listen to the patient, I touch the patient, you know, and I do a comprehensive evaluation and get them feeling better on the first session. Most times that would be a 45-minute evaluation with a PT, and then that's the only alone time you ever have with them. So you just have to look about, you know, whether it's PT you need or chiropractic or whatever, you have to look at what is my cost benefit. So yeah, my deductible is this, but I'm going to get better faster with less sessions here. Maybe that's a little better fit for me. Just food for thought. So
Yeah.
anyway.
Well, and I think the perspective is also just incredibly different because to your point, yes, they're gonna lean toward those, x-rays and all of that type of stuff. But also there's the meds. That's another big component is that they want to mask the pain, which you just taught us is very important for understanding where we are in the healing process, right? And so
Absolutely.
not always
Absolutely.
something you want to do.
Right. And it's not treating the issue. They're treating the
Right.
local issue. And that's why we have a huge opioid epidemic with painkillers. And painkillers don't help the pain. you know, and addiction is a huge setback. Now, there are some medications like Cymbalta, Lyrica, and gabapentin that are cell membrane blockers. And what that means is it actually affects the nerve that's transmitting the pain response. So
Mm.
if a person is having trouble doing no pain medication at all, that's something to explore with the help of a medical professional. But that's much better than a pain medication. We have also, everyone is using anti-inflammatories, which is not good. So if you don't know this, you really need to avoid using long-term anti-inflammatories. This means over-the-counter Advil, Motrin, Aleve, can't remember the generic name for Aleve, naproxen, or even, now mind you, there are people who have autoimmune issues that, that have autoimmune issues that obviously will need this long term. So this is just not saying that. But like prednisone or like, oh, my back's out, I'm gonna get a steroid dose pack again. Okay, so you're helping the inflammation, but why are you having the inflammation? You need to treat that. You need to figure out why this area is inflaming and treat that, not just treat the inflammation. You're going to be going like this again and again and again. And then, things like ulcers and that kind of stuff can happen with long-term use of anti-inflammatories. Same thing with Tylenol. Tylenol can affect the liver. And right. So we don't want to be on that long term. Again, let's not medicate it. Let's figure out why it's happening. For example, an easy example, I have patients that come in all the time with bursitis. Bursitis, so bursa is like a fluid-filled sac. The most common example I can give you is people who are in boxing. We have bursas right here. And when they get hit near the eye, what happens? The eye swells shut. Not the eye swelling shut, it's the bursa swelling up and closing right there. Okay. So we have a bursa in our hip and we have our elbow, etc. And they'll come in, their bursas really, like, I have bursitis. I've tried this, I've had injections, and it never really gives me long-term help. I'm like, let's figure out why you have bursitis. Most long-term bursitis is because the glute muscles are too weak. You have a lack of extension range of motion in your hip. The IT band is too tight, any of those things. And so I do treat the bursa to calm it down, but I'm also treating everything else. So as the inflammation calms down, it will stay down and not come back. That's just an idea of the way I look at things, where if you would go to just a typical MD, they would give you an injection in your bursa and say, and hopefully they'd say PT as well. That would be a good choice. But yeah. So again, just to summarize, the pain is not just a isolated thing. It's this, okay? So we need to treat this. And what you can do is you can, and even if you're not having pain, just think about, okay, stress. Do I get really stressed, right? Which I think we kind of all do, whether it's work or kids or home or all of it, or the fact that humidity is 96% here every day. I don't know. So we just need to work on just doing some breath work. Maybe instead of listening to music in the morning to be like dance music, get yourself ready, more relaxation music. So you're going to work and your nervous system is here, especially when you get into traffic. Think about laughter. And maybe counseling might be part of the issue for you. A free app, well, it's a free trial app. There's an app called Curable, Curable. Okay. It's on the App Store. You get a free 2-week trial if you subscribe. You can always cancel. And it's a combination of pain neuroscience education, which we know helps, meditation, visualization, and learning about journaling emotions out to help with chronic pain. It's absolutely amazing. So maybe check that out and see, and you can always reach out to me if I can help for any reason. So I hope that was a little bit helpful.
Amazing. Yeah. I mean, it's mind blowing when you think of the difference in the approach of a more holistic approach versus the allopathic approach, and makes so much sense when you look at, overall where we are as a society, because so many of us, I mean, we're incentivized to go the medical route always, right? Like that's what insurance exists for, and we all pay it. So, hey, why not use it, right? But that's where we get these dependencies on all of these drugs, and even the ones that aren't like as scary, we still get people who are on them forever. And then eventually they have some other issue pop up and then another issue. And it's like, well, gosh, you're on so much stuff. Like you're just medicating the side effects of the other medications, right? So it makes so much more sense to go and to see someone who specializes in this world, who can absolutely identify issues. And that's kind of what blew me away from coming in, is like, I knew you'd be thorough and wonderful, and I already knew you were kind, but really seeing how it is not like you going down a checklist of like, these are the 8 things I'm going to do today. It was like, oh, well, this, okay, well, then I want to do this. And like, oh, because of this result, I want to now check that. And it was like, it was just all so logical and directed by what you, like, you were being informed as you were going through the step. It wasn't just like a check, 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 all done. I think you have this, it was very deliberate, intentional, and it all made sense, right? And so I think this is amazing. I think this is like absolutely the way, I mean, obviously everybody knows that I think this is the way, right? Doing things a little bit more naturally, understanding our root cause issue. Jenn, I am so grateful. Can you please tell people, how do they find you? How do they contact you? If they want to work with you and schedule a consult, what's the best way?
Absolutely. So my website is Physical Therapy by Jenn, and it's Jenn, so 2 N's.
Okay.
So it's the same handle for my Facebook and for Instagram as well, and you can reach out any of those. My phone number is 704-585-8381. And you can call that number, you can text that number anyway. Even if you like have questions for me that you don't know if I'm the right fit for you, you're not sure who is the right fit for you. I love to help people, even if they don't end up seeing me. I want them to get the help they need. So I would say half the phone calls who call me, I'm helping them find someone to help them that may not be me or may not be in my area. But yeah, definitely reach out. My email is Hause, so it's JHAUSE at ptbyjen.com, which is also 2 N's. So just find me and reach out, and we can always schedule like a free 15-minute talk or consultation, so we can just see if I'm the person to help you or if I can help you with what's going on.
Okay, cool. And do you do any of those consults on the phone, or are they in person?
I can do either. Yeah,
Oh,
I
perfect.
do. I do a lot on the phone, but if you want to come in and just do a 15-minute talk, we can.
Yep.
I find doing the talk helps because to make sure that it's what you want to do. I have some patients who come from far away to see me, and they want to make sure that we're a right fit before we go forward, which I totally get.
Yes, for sure. Yes, especially anytime you're having someone lay hands on you, you want to be comfortable with that person. And
Absolutely.
Dr. Jenn is so wonderful and laid back that she's a pleasure to work with.
And I didn't pay her anything to
Amazing.
say that.
Well, thank you so much, Dr. Jenn. Anything else that we should add or interject before we hop out?
No, I would just challenge you to take a minute every day to just do some breathing. Let's say you get somewhere, you're a little bit early, or you get home, just spend a minute in the car just doing some breathing in through your nose, out through your mouth, nice long exhalations, and just see how that can just bring your nervous system down to face whatever is ahead the next minute of the day.
Love it. Okay. And obviously everyone can find you on our website at thinkcrunchy.com. You are one of our lovely practitioners, and we are so blessed to have you in our community. So thank you for all you do and all the education you provide. We are so grateful.
Well, right back at you.
Oh, thank you. All right. Well, thanks everybody. Thank you for being here. If you want to reach out to Dr. Jenn, she just gave you all the lovely ways. We'll make sure that we put some of that contact info in the description as well so that it's easier to find her. Thank you for being here, and we will see you all soon. Have a great day. Thanks, Dr. Jenn.
Hi, thank you.
Bye.